Mexican Americans come in all different shapes and sizes, as well as shades of skin. A Mexican American is defined as a U.S. citizen or resident who was born in Mexico or of Mexican descent. Mexican Americans born in the U.S. are sometimes also referred to as Chicanos. Mexican Americans first resided in America due to the Mexican-American War, which concluded in the year 1848. Texas was the first Mexican state to become part of America in 1836, and the land known today as New Mexico, Arizona, California, Nevada, Utah, and Colorado, along with its inhabitants, followed soon after America's victory. The treaty that ended the war on February 2nd, 1848 is known as the Treaty Guadalupe Hidalgo. This treaty gave Mexicans living in territories that were conquered a year to move back into Mexico. Those who stayed were given U.S. citizenship and federal guarantees. These included that their rights, property, and white racial status would be honored and held inviolable. Mexican Americans generally settle in states near the Mexican border. In terms of numbers, California and Texas are the two states with the highest population of Mexican Americans, California being number one and Texas coming in second. However, New Mexico is the state with the highest percentage of Mexican Americans overall. There are many notable push and pull factors that brought Mexicans to America. The biggest push factor was due to the rising rates of unemployment among the impoverished. Other notable push factors include higher crime rates in Mexico, drug trafficking, and the lack of doctors. Some pull factors include gold being discovered right before the conclusion of the Mexican-American War in California, higher wages, and greater job opportunities. Mexican immigrants were needed in the United States from 1900 to 1929 because the labor of other easily exploitable immigrants had been severely restricted. Due to this, Americans were actively seeking out Mexicans for employment to work on farm and other jobs that required manual labor. Mexicans were more than happy to move since they would be earning nearly 8 times more the wage they would be making in Mexico. In the next few slides, I will discuss a few things that healthcare providers should keep in mind when working with Mexican Americans. Firstly, sometimes the language barrier may exist between the healthcare provider and the patient. Not all Mexican Americans come from families that have been in the States for generations. Therefore, communication may be difficult. In regards to speaking English, most Mexican Americans are capable of speaking English. However, English may continue to be a problem among the elderly who are first-generational Americans. This is not because they refuse to learn English, but rather because of embarrassment. Healthcare providers and community members should provide an encouraging and safe learning environment. Another fact people should keep in mind is that many Mexican Americans can't afford the greatest healthcare or do not have health insurance. This has to do with the low-paying jobs that these people work. Many Mexican Americans do not have the means to be financially comfortable because of the lack of qualifications. In many cases, Mexican Americans had to drop out of school to help their family earn enough to keep a roof over their heads. Another characteristic about the Mexican American people to keep in mind is their belief in home remedies. Just as we have discussed in class, Mexican Americans have traditions and beliefs that have gone back for hundreds and even thousands of years. Herbal teas and medicines have been used by them to treat illnesses. Herbal teas are often used instead of Western medicine because of affordability and sometimes lack of health insurance. In addition to herbal medicine and teas, mud therapy has been used to reduce swelling. I am Mexican American, and whenever I got stung by a bee, my abuelita would always smear mud on the sting. She also did this when I sprained my ankle once. The mud would stay until it hardened. As a kid, I always thought it was silly that mud could be used as a form of treatment, but it always seemed to work. As discussed in class, many Mexican Americans believe in curanderismo. Curanderas or curanderos are shamans who use several different tactics to heal an individual. In one of the videos we watched this semester, a curandera can be seen rubbing an egg all over an individual's body, so to absorb all the negative energy into the egg and heal the person. The main dominant religion that Mexican Americans identify with is Catholicism. Catholicism is a sect of Christian faith and includes La Virgen de Guadalupe. Our Lady Guadalupe is also known as Saint Mary, as she is mother of Jesus Christ. Mexican Americans are very religious, and religion has great influence in their lives. Healthcare providers should be respectful of these beliefs and allow visitation from priests when possible. Another thing healthcare providers should be aware of is the belief of machismo. This isn't a belief that applies to every Mexican American household, but it should still be known. Machismo is the belief that the father is the head of the house and that no decision of any kind can be made without his consent. Healthcare providers should show respect and include the father in the decision-making process whenever a decision is needing to be made for treatment purposes. Healthcare providers should also be aware that Mexican American men tend to be macho men. In other words, they try to portray that they are superhuman and do not feel pain, when in fact they do. Healthcare providers should establish trust and practice personalismo to allow male Mexican American patients to open up and honestly share how they are feeling. Lastly, healthcare providers should know that there are differences between the United States healthcare system and the Mexico healthcare system. When it comes to care, some Mexican Americans do not know the correct facility to go to for their medical situations. When it comes to hospitalization, in Mexico, family members take up the role as a nurse and provide bedside care. In America, although nurses can provide these services, healthcare providers should do their best to accommodate to these patients' needs. Poverty among Mexican Americans, in addition to having to drop out of school to help family, can be credited to many Mexican Americans not knowing how to apply to college. The education is different in Mexico, and many parents do not know how to help their children post high school graduation. Many Mexican Americans do not know that they could apply for financial aid and cannot afford a higher education. Mexican Americans face much discrimination not only in healthcare setting but in society as well. In 2010, the governor of Arizona passed Senate Bill 1070. This bill gave law enforcement the right to ask people of suspicion for documentation. This power was abused, however, and many were pulled over solely based on their color of their skin. This caused much chaos among the Mexican Americans. In 2013, the young native Texan mariachi named Sebastian de la Cruz faced racial discrimination after singing the national anthem before Game 3 of the NBA Finals between the Miami Heat and the San Antonio Spurs. Much backlash and criticism was made on the internet about Sebastian, falsely labeling him as an illegal Mexican. In closing, we must remember our divine identity. We are all precious sons and daughters of our Heavenly Father, and He loves each and every one of us. Just as DNC reads, remember, the worth of souls is great in the sight of God. We must treat our Mexican American brethren as equal and make the effort to not only get to know them and their culture, but to also make them feel included. Thank you.